Hi, I'm Katie from Vet Med Wear, and I'm here to show you how to use your new Spooter shirt, the post-operative recovery gown, universal for males and females. The first step to using your new Spooter shirts is to choose the correct size for your patient. To size the patient, have them stand in front of you facing straight. Ensure their head is not bending to the right or to the left. Once they're straight, you can secure them on the table by reaching around them. Use your measuring tape to measure from the humerus back to the femur. The measurement should be midline to midline. You can take this measurement and use it with the sizing chart to choose the correct size for your patient. First, we will configure the gown for a male patient. There's two important things to keep in mind when configuring for males. The first thing to do is lay out the gown and orient it accordingly. The support strap here will be the front of the gown. This will hold the gown on the shoulders for the males. The second thing we should do is open the hole for the prep use. This area here comes sewn shut as the gowns come unisex. You will have to cut open each section by cutting the two areas with the green thread. The first area allows the prepuce hole to open for the average patient. By cutting the second area, you allow that prepuce hole to open for larger patients. First, you'll peel open the hole to expose the green thread. You can then cut the thread using regular office scissors or surgical scissors. Cut the green thread just once. Then, pull open the hole, exposing more green threads. If needed, you can cut again and open the hole. The hole should open readily. Clean up the green threads by just removing them. These can go in the garbage. Once the hole is open, you can then open it again for a larger patient by repeating the same process with the second section. Expose the green thread. Use your scissors to snip the thread. Pull gently. If needed, expose more of the green thread. Don't be afraid to cut the gown. You won't cut through the seams and you won't unravel the gown. Now you see that the gown is fully open in the male configured position. You can finish by cleaning up the green threads. The gown is now ready to apply to a male patient. Once you have the patient's legs in the gown, you can tie it. You're going to take the string from the right side and pass it through the loop on the left. The crisscross design allows the strings to stay up better and reduces the amount of strings needed on the gown. Right string through left loop. You're going to repeat this with the other side. Left string through right loop. Lift the gown to ensure that it's sitting squarely on the shoulders of the dog. You don't want it sliding down. The support straps should be sitting in the middle of the chest. Once that's complete, you can tie the gown at the back using a bow or a double knot. It's best to tie the knot nice and tight so the gown will stay secure. Make sure that you can fit a finger underneath the gown to ensure it's comfortable on the animal. Once you're finished the top, you'll move to the back. Repeat the same procedure, opposite string to opposite loop. Opposite string to opposite loop. Tie in the middle. Again, nice and comfortable, allowing that space between the tie and the body. Secure, but not uncomfortable. Great, now you're ready for the middle strap. Now we can tie the belly straps. These support straps have two important features. The first one, simply take them as they naturally sit and tie them along the back. Remember, you want to tie them securely, but comfortably. Tie them tight enough that they'll stay up, but enough that you're not digging into the skin of the animal. As you'll see underneath, this support strap has a very important function of holding the gown taut against the belly. This allows the animal to urinate without urinating on the gown and without the prepuce sliding back through the hole during urination. The second configuration is a crisscross. Simply take the middle straps and crisscross them underneath the belly. Simply tie them the same way we did before. With this configuration, it closes the urination hole. That allows for the prepuce to remain inside the gown for any kind of injuries such as road rash where the prepuce would have to remain inside and clean. Next, we'll configure the gown for a female patient. The first thing to do is orient the gown accordingly. Whereas this was the front of the male, it is now the back of the female. The female's patient head should be right here. The first thing you're going to do is cut the support strap. This is important for the males as it held the gown on their shoulders, but for the females, we're going to cut it off to allow them to urinate. Simply snip using your scissors and discard. The gown is now ready to apply to a female patient. Now that we've cut the support tape, it's time to dress our female patient. Dress the same way as the male. It's best to dress them under anesthetic so we can easily manipulate the limbs. Simply slip the legs through the front cuffs and then slip the legs through the back cuffs. Similar to the male, ensure that the front of the gown is sitting squarely on the shoulders. The dip in the back should be deep enough to allow them to urinate. Ensure to check that this is a correct fit. Now that we have the gown dressed, it's time to tie it. You can tie it in two different ways. For the medium to extra large sizes, it's best to tie them the same way we tied the male. Opposite string to opposite loop, simply pass them through, and opposite string to opposite loop. Tie securely. Same with the back. Opposite string to opposite loop, and opposite string to opposite loop. It's important to note that once you tie these knots, you should trim the strings of excess. Any excess string should be trimmed off so it does not pose a hazard to the animal. Once the knots are tied, simply use scissors to remove the ends of the strings. Secure the belly strap around the belly. Since the gown is unisex and the prepuce hole is not opened, no need to crisscross. Simply tie securely around the back. And again, trim the excess. For female cats, as well as small female dogs, there is a more securing tying method. What you'll do is take the front straps, tie them together around the neck. Make sure to tie securely and safely, but not uncomfortably. By tying around the neck, especially for cats who lack a true collarbone, it allows for a more secure fit. Ensure that the gown sits flush against the chest. Take the belly support straps and pass them through the opposite loops as we did with the previous tying. Opposite side to opposite loop. Tie securely along the back. It's important to trim the excess string as we don't want anything hanging off the gown. One of the benefits of Spooter is that you don't need to remove the gown for the animals to eliminate. However, should you need to remove the gown, simply untie the strings. It's best to untie the top, then the back, and then the support strap in the middle. Remove the strings through the loops and simply peel off the patient. Front legs first, then the back. The gowns are machine washable, pre-shrunk, and hypoallergenic. If they are dirty, you can machine wash them and then apply to the patient again. It is important to note that reflective tape on the gown is an added safety feature and is not a loop. When securing the belly strap, ensure that you do not pass it through this reflective tape, but instead tie it securely around the gown. Thank you for choosing VetMed Wear. If you have any questions, please don't hesitate to contact our customer service department. Thanks!